All right, we got a 72-year-old man who loses consciousness for 30 seconds, and then he spontaneously regains it without confusion and neurological deficits. He has hypertension, type 2 diabetes. On examination, his pulse is at 38 beats a minute, and his blood pressure is 120/70. ECG says regular bradycardic rhythm with narrow QRS complexes and complete dissociation between the P's and the QRSs. Okay, so this is interesting. Complete dissociation makes us think of a third degree block, which means that the atrial contractions and the ventricular contractions are not lining up with each other. That's third degree. 2 would be Mobitz type 2. That's when it's elongating the AV node conduction and then it drops one. So it's not going to be that. It's going to be number 3. So which of these is the pacemaker? So SA is a pacemaker, but then you wouldn't be having 38 beats a minute. You'd be having normal. Left bundle branch is not a pacemaker. It does conduct. So does the ventricular metacardium, but it's not a pacemaker. Purkinje fibers, that'd be super slow and it'd be wider QRS complexes. His bundle is correct because it's just going to be the narrow QRS complexes. So here's our SA node, AV node, his bundle. Purkinje fibers are fast. Last resort, pacemakers if everything else fails. They'd be super duper slow and wider QRS complexes. And no coordination tells us that it's third degree complete heart block. And so here's an example of what that might look like. Narrow QRS complexes have escape rhythms that originate from the His bundles. And so the His bundle is the correct answer, because it sets the pace of the ventricles at the intrinsic rate of 40 to 60. And Purkinje fibers, if those were the pacemakers, then the QRS would be wide and it would be much slower. And it's borderline between the two of them, but the important thing is that the QRS is narrow. And if the QRS is narrow, then it's going to be the His bundle escape rhythms. So not the SA node, because it's not reaching the ventricles due to the AV block. It's not the bundle branches or the ventricular myocardium, because those are not intrinsic pacemakers. And it's not the Purkinjes, because that would, while it does have a 25 to 40, it would show the wide QRS complexes due to abnormal conduction. This one had narrow, and so that's why the answer is going to be His bundle. All right, so hopefully that was helpful. If it was, then like and subscribe.